Our next topic is AVF. AVF means an arteriovenous malformation or an arteriovenous fistula. When we talk about this AVF, it is an anomaly of the blood vessels where the artery is in direct conjunction with the vein. What happens because of that? You should understand an artery is thick-walled whereas a vein is thin-walled. The hydrostatic pressure in an artery is much more than that of a vein. So when the blood rushes from the artery, there is high possibility of this vessel or the vein to get collapsed or rupture. So rupture or hemorrhage is a complication of AVF or an AVM. Okay, so that is why you might have heard of patients who have lost their lives because of intracranial hemorrhage, because AVMs are pretty common in the central nervous system, meaning brain also. So we need to figure out what is the type of this AVM, whether it is congenital or acquired. In some cases, we also create the fistula, which is an arteriovenous fistula. This is a physician-induced procedure. Usually, such procedures are created for ESRD or end-stage renal diseases. Imagine a vascular surgeon is creating a fistula by transposing a vein which is a cephalic vein. A cephalic vein transposition. Okay. So based on that, what is a vein that is being transposed? You have separate codes, whether it is basilic vein or the cephalic vein. Sometimes the physician might institute a graft, or he might place a graft in between the artery and the venous components. In such case, you need to select the code for the non-autogenous graft. Plus, after creating of this fistula, there could be complications as well, right? Now, the patient has developed a blood clot. In that case, a physician has to do a thrombectomy. Thrombus meaning a blood clot, ectomy meaning a removal. So, you will have to select the complication as a thrombectomy of a graft, which is a AV graft.